Hello, everyone. My name is Sergio Rodriguez, and I am an occupational therapy student. This training module is titled Promoting Inclusive Fitness Spaces. So, first of all, we want to go over the learning objectives before we go on to the material. So, the first learning objective, staff will be able to demonstrate at least two inclusive communication strategies, such as using person first language or asking permission before offering assistance. Second learning objective, after the training, staff will be able to identify at least one physical barrier within the gym that is not ADA compliant. And last but not least, after the presentation, staff will be able to differentiate between visible and invisible disabilities. Throughout this presentation, we will be going over several things. First one is why inclusive fitness matters, understanding different types of disabilities, legal and ethical considerations, inclusive communication strategies, creating a more welcoming environment, as well as talking about Special Strong. So, now we want to talk about why inclusive fitness matters. Exercise has played a crucial role in assisting individuals improve their physical fitness while sustaining a healthy lifestyle. Exercise is a natural medication that has helped in preventing common chronic diseases as well as playing a role in the treatment of these disease processes. Engaging in physical activities allows the body to release endorphins, which can assist in boosting an individual's mood, alleviate stress, and reduce symptoms of depression. When it comes to engaging in exercise, there are a variety of different ways to engage in physical activity. Fitness facilities, in particular, provide individuals with the space and equipment necessary to improve their physical fitness and well being. By providing a more inclusive fitness environment, it will increase every individual's opportunity to feel safe and confident in engaging in exercise to help improve their overall health and well being. Now we will be covering visible versus invisible disabilities. Visible and invisible disabilities have many differences. To start off, visible disabilities are disabilities that are seen by others and are usually due to physical characteristics or due to the fact that individuals require DME. DME is defined as durable medical equipment, which can consist of walkers, wheelchairs, hearing aids, prosthetic legs, along with other medical equipment. Invisible disabilities, on the other hand, are disabilities that are not present in a physical form. Examples of this can be mental illness, chronic pain, diabetes, fatigue, autoimmune diseases, along with others. According to the CDC in 2022, there are approximately 61 million people in the United States that have some sort of disability. And among this 61 million, there are around 6% of the population that use some sort of DME or durable medical equipment. The other 94% do not have or use any sort of DME. Now that we have talked about visible and invisible disabilities, I do want to talk about different types of disabilities that you as a staff member may encounter when engaging at the gym. To start off, let's talk about physical disabilities. Individuals with physical disabilities may present with weakness and limitations of muscular control. They may present with involuntary movements such as tremors, lack of coordination, paralysis, decreased sensation, along with joint disorders. Examples of this may be cerebral palsy, which is a non progressive disorder that is usually caused by abnormal brain development or brain damage that can affect an individual's ability to control their muscles. Another one might be spinal cord injuries, which are damages to any part of the spinal cord or nerves at the spinal canal. This can result in one having permanent loss of strength, sensation, and function. Amputations are also another physical disability, which is the removal of a specific body part that is covered by the human skin. This could either be upper extremities or lower extremities. Causes of getting an amputation may be due to a severe accident, animal attack, severe diabetes, cancer, surgery, along with others. The next one is sensory disabilities. Sensory disabilities are neurological disorders that affect the brain's ability to process sensory information such as sight, smell, taste, touch, and hearing. Examples of this may be autism spectrum disorder, which is a developmental disability that causes an individual to have challenges with communication, social, and behavioral issues. Low vision is also another example of sensory disability, which causes individuals to be unable to recognize images from far away or have difficulties with differentiating between colors. Deafness or loss of hearing is defined as the inability to hear from one or both ears. Causes of this can be due to maternal rubella or other infections that have occurred while in pregnancy. Low birth weight, a lack of oxygen at time of birth, which is also known as asphyxia. Last but not least, we want to talk about sensory processing disorder, which is a neurological condition that causes the body to not properly interpret the sensory messages from the brain and convert them into the appropriate motor and behavioral responses. This can lead them to feeling overwhelmed or being overstimulated in certain or specific situations. Lastly, we want to talk about mental health and invisible disabilities. When we talk about mental health refers to our emotional well being, our psychological well being, and our social well being. This affects how we feel, how we act, and how we think, and how we handle our stress, relate to others, and how we make choices accordingly. On the other hand, invisible disabilities are disabilities such as anxiety, depression, PTSD, or post traumatic stress disorder, chronic pain, fatigue, or autoimmune disorders such as diabetes, multiple sclerosis, or rheumatoid arthritis. Now that we have went over some visible and invisible disabilities along with physical, sensory, and mental health, now it's important to talk about legal and ethical considerations when wanting to create and build a gym that is inclusive and accessible for all individuals. There are some laws to keep in mind that fall under the Americans with Disabilities Act. These are Title II, Title III, and Section 504 or Rehabilitation Act. Under Title II, this regulation, state and local governments are required to provide individuals with disabilities equal opportunities to engage with and benefit from all programs, activities, and services. This includes schools and recreational facilities such as the gym fitness center. Under Title III, all businesses that are open to the public must provide and ensure that their businesses are accessible to people with disabilities through reasonable modifications to policies and procedures. Lastly, we got Section 504 or Rehabilitation Act. Under this law, no qualified individual with a disability in the United States should be excluded from engaging in certain activities, be denied benefits, or be discriminated against under any program or activity. This includes schools and recreational fitness as well. Now that we have covered some of the laws and regulations that fall under ADA. Now it's always important to keep in mind 7 universal design questions, such as equitable use. Does the design of the gym equipment allow it to be used for a wide range of abilities? Flexibility in use. Can the gym equipment be used in different ways to target different muscles? Can it be easily accommodated for individuals with visible and non visible physical disabilities? Simple and intuitive. Are individuals of all abilities able to easily understand and use the equipment safely and appropriately, as well as independently? Perception, information. Do you or the gym equipment provide the individual with feedback in a variety of ways to allow them to exercise safely and independently? Tolerance for safety. Now, here, safety is key. Are there any safety mechanisms that can be used while engaging with a specific equipment? Low physical effort. are there objects within the gym that can be modified to allow for efficient and comfortable use with minimal fatigue. Lastly, we got size and space for approach and use. Does the gym provide a good amount of space between equipment for individuals to get through, including those with mobility devices? After looking through the 7 universal design questions, now it's always important to look through some assessments that you as a staff member can use in order to make a gym more inclusive and compliant with ADA recommendations. The first one that we are going to look at is the ADA checklist. And I recommend you pausing this video and try to scan the QR code to your left hand side, which sends you directly to the ADA checklist. So the ADA checklist is a checklist created by the state and local governments to make sure that services, programs, and activities are accessible to individuals with disabilities. The checklist goes through the 4 priorities that are listed within the Department of Justice Title III regulations. And by all means, pause this video so you could go through it with me. So the first priority that we are looking at looks at the accessible approach and entrance. Examples of this include parking spaces, ramps, accessible routes to get to the main entrance, and the entrances to the buildings. The second priority looks at the goods and services that are provided within the gym. This includes the interior accessible routes, ramps, accessible doors, and handles, along with others. The third priority that we are looking at looks at how accessible the public restrooms are. This includes the route to get to the restrooms, the signs, the soap dispensers, and hand dryers, along with other sections. Lastly, the fourth priority within the checklist looks at how accessible other items within the building are, such as water fountains and paper towels within the gym. The checklist also has other sections within the site that one would access to assess their facilities, such as the swimming pools, exercise machines, and equipment. Next, we will be going over the AIM-free or the Accessibility Instrument Measuring Fitness and Recreation Environment, or as we all shorten it for AIM-free. And by all means, you could pause this video and scan the QR code to your right hand side, which sends you directly to a PDF, which is a AIM-free document. So the AIM Free was created to provide individuals and professionals with a series of survey questionnaire measures that they can use to assess the accessibility of fitness facilities. It is divided into several sections that covers a specific area within the facility. Within this video, we will only be covering section A, B, C, D, G, and L. In Section A covers the accessible routes and entrance areas. Section B covers the equipment used within the gym. Section C covers the information provided within the facilities, such as the signs. Section D looks at locker rooms and showers. Section G covers accessibility to bathrooms, and Section L covers accessibility to swimming pools. Now, there are other sections that you could look through, which also talk about different areas within the gym. But these sections that I mentioned right here are some sections that should be looked at and should be pinpointed when wanting to make a gym more accessible. Now you could scan the QR code, or I did provide Amy with a copy, which is in the recommendations binder. And by all means, you could use that recommendations binder, use that aim free tool, and print out in order to start making recommendations or seeing what needs ADA approval. In this section, we will be covering inclusive communication strategies. This signifies finding ways to communicate with individuals with disabilities and knowing when to help out and when it's necessary to pull yourself back when wanting to assist someone with a disability. The do's and don'ts when communicating or engaging in a conversation with an individual with disabilities. So let's go on to the do's first. So when engaging in a conversation or communicating with someone with disabilities, it's always important to use person first language. This term used is to refer to individuals with disabilities that emphasize the person first and their disability second. Next, always ask before helping. It's always important to ask someone if they need help instead of assuming that they do, due to the fact that it may be a goal that they are setting for themselves, and if you try and help them, it's going to feel like they're not achieving anything. Next, provide the given information in different formats. By providing information in different formats, such as in verbal or written form or any other form, it allows individuals to not feel excluded. It makes them feel more included when engaging in activities, physical activities, exercises. Lastly, it's always important to be patient and actively listen. By doing this, it not only builds rapport, but it also helps them feel more comfortable with engaging in exercise, feeling more welcomed, and wanting to conversate with you and telling you and showing you that they do need assistance or they don't need assistance, and being able to socialize with others around. Next, let's go to the don'ts. So, when engaging or conversating with someone with a disability, don't assume what someone is and isn't able to do within the gym. Don't touch mobility devices without permission. And this goes a long way due to the fact that one, as an individual, doesn't like their personal items being touched unless they ask and unless they give permission. So it's always important to keep that in mind. Lastly, don't disrespect personal space and boundaries. This also goes a long way due to the fact that everyone has personal spaces and boundaries that they set, and they wouldn't want someone to come in and step on their personal space, which is something that is disrespectful for everyone. Tips to keep in mind when wanting to engage or communicate with someone that has disabilities. When engaging in a conversation, always be able to maintain eye contact. Demonstrate that you are actively listening through your body language. If you are unsure if someone needs help or not, it's always important to ask. For example, hey, I noticed that you are struggling a bit. Do you need help with anything? Lastly, treat people with respect. As I mentioned before, treating people with respect is really important due to the fact that you want to treat people with respect the same way they treat you. In this section, we are going to be covering ways to create a more welcoming environment within the gym in order making it more accessible and inclusive for individuals with disabilities. When arriving at a fitness facility, it is always important to provide a welcoming environment so students, including students with disabilities, can feel comfortable and welcomed to work out, engage, and socialize. The reason for this is that many individuals who have physical disabilities or any other sort of disability tend to experience psycho-emotional disableism. This refers to the psychological and emotional impact of experiencing disableism, which is prejudice, discrimination, or social barriers against disabled people. For example, many individuals can feel uncomfortable when they are stared at and judged by other students who go to the gym. This feeling of discomfort and or exclusion can be a barrier to one's health, wellness, and participation within the fitness facility. For these purposes, there are some recommendations that one can keep in mind when making a gym that is more inclusive and accessible for all. For example, the implementation of inclusive visual posters. By implementing visual posters throughout the gym, it can provide a sense of belonging and welcome. This allows for the fitness facility to be more inclusive and welcoming. And as shown in the prior slide, that was a small poster that also provided to Amy within the recommendations binder, which talks about inclusivity by bringing the community as one. Next, the implementation of student driven music. By implementing music that is controlled by students, it allows for diversity, promotes emotional safety, and increases one's motivation. By incorporating music, it can increase positive feelings and decrease negative feelings associated with the physical effort and fatigue. Lastly, an anonymous feedback suggestion box. The incorporation of a feedback suggestion box will allow students to the power to voice their concerns and opinions, as well as give vital suggestions to make the gym more inclusive and accessible for all students. The feedback received can be reviewed by the whole staff either monthly or quarterly. In doing so, it allows the staff to be on board and find ways to better assist students and make the gym more accessible for all. In this last section, I do want to talk to you guys about a program that is out there that you guys could use to your advantage in order to find ways to be able to work with individuals with disabilities. This program, called Special Strong, is a program that provides adaptive fitness personal training, group fitness socialization classes, and aquatic therapy for special needs with cognitive, physical, and mental challenges. For those who want to become an adaptive fitness member, will get access to home workouts, group classes, adaptive workouts, along with other resources. And if you go through this training, there are many things that you will learn. For example, you will learn how to assess clients with specific conditions. You will learn how to create custom workouts and exercise programs for all abilities. You will learn how to master effective adaptive exercise programs. You will learn communication techniques and strategies. And you will learn how to transform lives and communities, along with other information. And I did provide a QR code to your right hand side if you want to get further information about the certification, as well as how much it costs to get that certification, what are the requirements to being able to get included in that certification process. I also provided their email and phone number just in case you guys want to reach out and get further information from them. So these are the references I were used throughout this presentation, and I would recommend you guys look through it in order to see if you guys are interested in a certain topic, in a specific disability, and just to learn more about disabilities and how to engage with people with specific disabilities. Thank you all for your attention. Thank you guys for listening to this presentation. And as part of the training module, there is a quiz after this presentation in order to help you guys better comprehend and understand the material that was provided. So by all means, once you get done with this presentation and listening to this presentation, go on to taking the quiz, as it's a short quiz and it won't take that long. And once again, thank you guys all for listening.